I'm Dr. William Numa. I carry out facial plastic and reconstructive surgery in the Boston area. I started out by training in otolaryngology and head and neck surgery, and as a result of that I got first-hand exposure to the intricate anatomy of the head and neck. It was very alluring, and the idea of being able to restore people's ability to speak, or their facial features or their facial contours, was very alluring. So the rewarding nature of the kind of work we do when we carry out procedures in the facial region was always a driver in my choice of subspecialty. So I carried out subspecialty training in just facial plastic and reconstructive surgery at the American Academy, by one of the fellowships of the American Academy of Facial Plastic and Reconstructive Surgery. As a result of that, everything I do nowadays has to do with facial plastic and reconstructive surgery. More and more, people are choosing to explore some non-surgical options or some minimally invasive surgical options. That's great in a number of different arenas. Clearly, facial volumization is at the forefront of that type of techniques, but there are a number of other different techniques that we carry out nowadays that carry minimal downtime and great outcomes associated to it. It's a matter of making sure that those trends stand the test of time, and it's important to be able to provide those kind of procedures in the context of a very safe type of practice. So it's an exciting publication because we were able to bring in the top rhinoplasty surgeons in the world to be able to share their insights into a procedure that's super challenging, and it's very, very rewarding to both the patients who perform it, but also the surgeons who strive to perfect it. It's an ongoing work process where everybody's viscerally invested in making sure that patients get the best outcome. The patients are also very emotionally invested in getting the best result possible, and it's important to be able to learn from our colleagues, not just from across our subspecialty, but also a number of other specialties which carry out the same kind of a procedure. I think the aim of the book was to be able to create a comprehensive textbook which would be able to appeal to not so experienced surgeons, but also to the grand masters associated to the procedure. Throughout the scope of the genesis of the book, we wanted to make sure that it was broad enough that anybody, from a resident standpoint, from either otolaryngology, facial plastic surgery, or plastic surgery, would be able to pick up the book and have a really broad, thorough, robust analysis of what's involved in the preoperative analysis, the execution phase, and the follow-up phase associated with each of the procedures that are described in the book.